5th, 2015 Sunday. This video is to teach the owner how to take care of the female dog after spaying. This is a Yorkshire City, Yorkshire Terrier, was spayed, just spayed at 6 months of age, about one hour ago, and it's awake already to go home. So the first thing is the e-collar should be on for 10 days at least. And if the dog can't eat, then take out the e-collar, then let the dog eat, and then put it back on again. But make sure the dog doesn't bite the stitches. Now the stitches are quite, for handing over, you can see the stitches are clean, there's no bleeding, so that's important to let the owner know. So to clean the wound every day, twice a day, so they will use the facial cotton, put in the antiseptic chlorhexidine, and then wipe the wound, and then after that plain water. After that use plain water with another facial cotton, plain water to dry it, just by touching it, because this wound is quite clean, so there's no need to rub against it. You can see the wound, there's no bleeding. Then after that, dry already, preferably 2 times a day. Then apply this Centralase cream onto the wound to aid in the healing. Okay, so that's finished. Now the thing that we always must give to the owner is the spay certificate, because sometimes the vet forgets to give. This is for the licensing, it's cheaper to have the dog certified spayed. Okay, this must be given to the owner. And the other thing is, the post-op, there are 2 things. One is antibiotics. One is antibiotic tablets, which we give, Baytril, half tablet per day. Normally 4 to 6 days will do, and there will be no infections. Then the painkillers, normally we use Tofidine, which is a small tablet, 1 tablet 2 times, or 2 tablets 1 time a day. Based on the weight, it's about 2 tablets 1 time a day. This all starts tomorrow, because today we are given the injection of a painkiller and antibiotics, so the dog doesn't need it. And basically, of course, there should be a surgical record. There should be a surgical record by the vet, and this is Dr. Daniel, on what to do, what's given, what in case of course, for good practice, it's the best practice to write down what is given. And there is the medical record, which we have a copy, and we give to the owner 1 copy. So any questions?
No. So I have to put the tablet inside the mouth,
You can do that?
Yeah.
There's no problem, right?
Near to the throat, right?
If not, then you powder the powder and put it inside a meatball.
Oh, okay.
So the first meatball, of course nothing inside, so the dog is hungry, make the dog hungry. So the dog will eat the first meatball.
She's taking dry food.
Yeah, but I mean for medication purpose.
Okay.
Or cheese ball. I mean, if
Okay.
the dog likes it, I don't know, he likes it. Some dogs like new things. So instead of you forcing through the mouth, you powder it, make it in the powder form, and put inside the center of the meatball or cheese ball. The first one, nothing, so the dog is so hungry, he just swallow it. Then the second one, of course, contains the medicine, or the third one also. So that way it saves you the trouble of having to open the mouth. You know, you have to grip the mouth like this, with the thumb and forefinger. You grip very hard, and then you throw the tablet into the back of the tongue, and then close, then rub the neck. This dog should be able to give direct.
Yeah.
Well, there should be no problem.
Okay.
But some owners have problems with it. So other questions? So
No.
this handing over procedure, any questions? Because
Will she vomit? after
vomiting,
that?
normally they don't vomit, unless you let her jump up and down the bed.
Okay.
So normally the dog should be better in a small place or cage for the first 2 days, if not more. Normally about 10 days, the wound will heal very nicely, and the stitches normally dissolve by themselves. So unless the dog is irritated by the stitches, otherwise they dissolve in 30 days actually, which is quite long. So the collar takes up 10 days, and if the owner wants, then she comes back to remove the stitches, because it takes a long time to dissolve, which is good for the dog actually. Because
2 weeks. 2 weeks.
2 weeks to tell if it is or the owner can use a pair of clean scissors just cut the knot. But I don't know if you dare to do it. Someone will dare not do it in case you cut the skin. So now you can see how many stitches are there. This one is how many stitches? Only four only, so it should be okay. So some cases I cover with a plaster. Take a plaster and cover to protect it against the floor. Sometimes the floor is wet. But in most cases it's not that necessary. But if you feel that you have to, then just get the what you call it, the plaster elastic, the good one, and then you just tape it.
Or cover up the wound.
To prevent any dirt or what from.
That one have to start when?
Tonight also can. Especially if the dog sleeps on wet area, dirty area.
Oh, okay.
Does she do that?
No. So far okay. But sometimes we sleep on the pea tray.
Then cannot. Better put the plaster on in that case. How you know? I give her plaster. Let's finish it.